So in this section, we're going to talk about how to maximize adherence to treatments that you've recommended for your patients on a daily basis. We're going to talk about the clinician's frustration, how to address the individual patient's complaints, talk about expectations that the patient has so that we can modify those if we need to, and also strategies to empower the patient. So one of the things that I've found over the years, Joan, is that I can get frustrated with patients with fibromyalgia.
Oh, yes, it can really be bedeviling.
And one of the things that I've learned over time is that oftentimes these patients will want further testing. They will have complaints that suggest you should possibly do further testing. And the way I handle that is specifically to tell them, you've had enough tests, and then what I'll do specifically is look at each one of the tests and go over them with the patient so that we know that they have had all the testing that they need. And then we need to find time to educate them further on fibromyalgia. In some cases, we like to bring family members in to actually discuss some of those things because oftentimes a significant other will say, I don't believe my patient or my spouse or my significant other has this because I don't see any outward signs of it. And we want to develop that conversation with the families as well.
It can be as frustrating for family members as it is for clinicians. It's my experience is that typically fibromyalgia patients come in with a very large book that contains all of the workup that they've already had. So you can certainly save time and money by not repeating those.
Right. And one of the other things patients also bring in with their own information that they've gotten off the internet that probably is not as accurate as what we would provide them with. So we need to provide them websites that have reputable information and also places that they can go where they might feel more supported, for example, a support group or something along that line. One of the things that I have found over the years treating fibromyalgia patients is if I've made every effort to try and educate the patient, try to get them to adhere to their particular treatment regimen, and they continually don't do what I ask of them, I will actually ask the patient or tell the patient I can't help them.
Well, it's a contract. It's both a behavioral and clinical contract between you and the patient. A lot of times I say to myself, if you're not buying what we're selling, it's not a good relationship.
Right. And so I've had the occasion, on rare occasions, to actually dismiss the patient from care. And that's an option. I think the people watching this should know that that's available to them.
Yeah, we don't have to keep every patient in our practice because they're there. There are limits to therapeutic relationships, and there are some ethical guidelines that surround that, but they're very easy to comply with.
One of the things that I found, too, is that if I know I have a patient that I'm going to see that has fibromyalgia and they have multiple complaints, I may actually structure the interview to say at the very outset, we're going to talk about one, possibly two of those complaints, and make sure that they understand that so that they don't go off those particular subjects. That way I have more control of the interview and I feel more...
Got to control the interview. If you don't control the interview, the patient goes down highways and byways that are not useful to them, not useful to you, and ultimately chew up valuable time.
Right. And in addition to that, from the beginning, I've always tried to, at the outset, try to set expectations for the patient. Again, referring to that pain score, if we can get you from an 8 down to a 4, that's a big improvement. It's not going to be perfect. Also, and I'm sure you've experienced this too, a lot of these patients have waxing and waning fibromyalgia symptoms. It's almost like a moving target. You can't quite focus in on one thing because the last time that was the most important event, and now the next visit it's something else. So it's a very difficult symptomatology to actually pin down.
It is.
And it's a moving target, as I said.
Right. It's not, and that's the problem. There's not, it's not a tight case. The case is a little fuzzy around the edges.
Right.
One symptom will pop up and then it will retreat, and it is difficult.
However, I don't know about you, but I think that if you put all of these particular pharmacological and non-pharmacological treatments into play, you should expect some improvement in the patient's symptomatology. If they're not improving, you've got to find out whether or not they're not adhering, et cetera, et cetera. But we do expect them to also take some responsibility in terms of what they need to do, again, kind of buying what we're selling, so to speak, so that they can actually get better.
I mean, you can't be there. You can be empathetic, but you can't be their friend. You can be objective, but you can't lose control of the clinical encounter, and realize that boundaries are a big issue for lots of these folks, and you've got to hold your boundaries tight.
Right.
Otherwise, you're not useful.
On the other hand, you also want to give them the benefit of the doubt by empowering them, by listening to their complaints, and again, in providing encouragement. One of the things that I found particularly true is to find out what the little details are in that particular individual's case that may not be allowing them or mentally blocking them from doing what it is that they need to do, and explain to them again that if that's something that's blocking, we can kind of lead them past some of those blocks, and hopefully in that way they'll adhere to the regimen that we're recommending.
For example, there's just a lot of medication side effect fears, and I try to spend a fair amount of time really letting patients know all medications have their little side effects. You just have to kind of try to tolerate what you can tolerate, because no matter what it is, it's going to have a little something.
So with all those things said, I think we hope that we have provided all of you out there in the audience some information about fibromyalgia that you can use in your daily practice. And Joan and I would like to thank you for following along in this, and we hope this is helpful not only to you but also to all of our fibromyalgia patients. Thank you.